Welcome to the Talking Therapies VR training package. To move between the user guide and the scenarios, use the right analog controller and push it upward. Make sure it's hovering over the teleporter pad where you want to go to. If you're not familiar with how virtual reality works, I recommend you have a quick watch of the user guide before you start the scenario. Welcome to the Talking Therapies user guide. Let's go over some of the controls to get you started. Let's start with the left controller. Press the Y button to bring up the menu. From here, you can adjust your orientation, navigate to the main menu, or exit the VR experience. Next, let's look at the grab button. Use the trigger at the back of the controller to grab an object. You can use the grab button on both the left and right controllers. Let's move on to the right controller. You can push the right controller's analog stick upward to move to a teleporter pad. You can use these teleporter pads to navigate between different levels, like the main menu and the patient scenarios. To bring up the GAD-7 questionnaire and the phobia scales, click the B button on the right controller. This will come in useful later on during the scenario. To select an answer, move your right controller and hover the beam over the answer you wish to select for 3 seconds. You've now reached the end of the user guide. You can use the teleporter to the right to navigate back to the main menu. Welcome to the Talking Therapies VR training package. To move between the user guide and Welcome to the Chris Edge patient scenario. Hover over the first question to get started. I'll be here to give you advice when you need it.
I'll need to confirm your identity so I know I'm speaking to the right person. Can I have your name, date of birth and address, please?
Yes, it's Chris Edge, 13 Chesterfield Road, Merseyside, and my date of birth is the 2nd of January 1980.
Thanks for confirming that. And in regards to how long this interview will be, it'll last around 45 minutes. Is that okay?
Yeah, that's fine. I'm not in a hurry today, so...
Perfect. Do you know what the role of a psychological well-being practitioner consists of?
No, I'm not completely familiar with what that is.
Okay, I'll give a brief summary. The role of a psychological well-being practitioner, or PWP for short, is to assess and support people with common mental health problems, mainly anxiety disorders or depression. PWPs support people with common mental health problems by identifying areas where the person wishes to change how they feel, think, or behave. PWPs also carry out risk assessments and provide support to patients over telephone, face-to-face, or online. Lastly, PWPs signpost patients to useful services such as housing and employment. Do you understand what the role of a PWP is a bit better now?
Yes, thank you.
Great. Have you ever heard of a CBT intervention?
I don't really know much about it, but my GP said that it's a psychological approach to treating either anxiety or depression.
That's right. Cognitive behavioral therapy, or CBT for short, is a type of talking therapy. It is a common treatment for a range of mental health problems. CBT teaches you coping skills for dealing with different problems. It focuses on how your thoughts, beliefs, and attitudes affect your feelings and actions. After each CBT session, you'll be set some activities to work on in your own time. Does this sound okay?
Yes, that sounds okay.
Brilliant, so let's get started. When did your anxiety start?
Why have you assumed it was anxiety I was suffering with? Anyway, about 7 months ago, I began to experience chest pains and palpitations for no apparent reason. I was scared that it was a sign of a heart problem because my father died of a heart attack. But my doctor said my test results were fine. I've been really worried about this ever since, and I've changed my routine to reduce taking risks wherever possible. I no longer spend time alone, and I always try to have someone to do the shopping with me. I struggled to be alone with my son in case I died, and he was on his own. I've also stopped walking the dog and seeing my friends. I drive the same route to work so my wife can find me if something bad happened. I've noticed the chest pains and heart palpitations have gotten worse over the past 2 months, but the doctor has said that there are no medical reasons for the pains.
This sounds like it's been really difficult for you. I'd be interested in us spending a bit more time looking at some of the things you've just mentioned in more detail. With whom is the problem better or worse?
It's worse when I'm alone, but even though I feel really bad saying this, when I'm alone with my son, it's much worse, because I'm scared of him being hurt if I died. My partner is supportive, but lately there has been some issues due to my sleeping problems.
When do you experience your problem?
It feels like I experience these problems all the time when I'm out of the house, but now that I think about it, it's mainly in the evenings, when I'm going to bed as I'm scared I won't wake up.
Where does this problem usually occur?
It seems like anywhere, but when I'm in any public place it's worse, especially when I'm driving. I've also experienced being anxious while I've been at home.
That must be really difficult for you. Let's move on to the next set of questions.
Mostly I feel scared and anxious
When you
because of
feel
the
this way,
symptoms.
what
I worry that I
thoughts
will
go
die
through
like
your
my
head?
father did. I also think I'm going to have a heart attack, and more recently I think I might faint when I'm hot. Lastly, I feel like I'm letting my son down.
What behaviors are you now doing that you didn't used to do or are no longer doing?
I've stopped being alone where possible, and if I have to be alone, I carry my phone, water, and wear layers to help keep cool. I also check my blood pressure at least once a day. I have stopped exercising as it makes my heart race, and I don't like it. I'm calling my partner more often to let them know where I am, and I drive the same route to work each day. I haven't been inside a coffee shop for a long time, which is something I used to enjoy doing by myself. I also struggle to be in crowded places. I've started going shopping with my mum and find holding onto the trolley helps me. Lastly, I no longer walk the dogs alone, and like I said before, I struggle when I'm alone with my son.
What physical sensations have you noticed since you started feeling like this?
I've mostly noticed the chest pain and palpitations. I'm having problems getting to sleep at night as I stay awake thinking about not waking up, so I watch TV or use my phone to distract myself. Because of this, I'm tired in the day and stressed and snappy first thing in the morning. I feel tired all the time. I've also recently started to get really hot and dizzy, which makes me think something bad is really going to happen to me. And even though this is really embarrassing to say, I cry for no reason sometimes, and I can't really explain why.
What was the cause of you feeling like this?
I suppose it was when I started thinking about my age and my dad's heart problem. Next thing I know, I'm getting these chest pains and palpitations.
Have you ever had these symptoms previously in your life?
I did experience some anxiety before the birth of my son Henry, but I just got on with it.
Just to make sure I've heard you right, I just wanted to summarize what you've said so far. The problem started 7 months ago when you started getting chest pains and palpitations for no reason, and you were worried that this could be something more serious. Since then, you don't like spending time on your own. You've said, public places make it worse, especially driving, but you feel a bit better at home or with your mum. You don't like being on your own, and being with your son makes you feel worse in case anything happens while he was there. Your mum tries to support you and comes to places with you. It's worse in the evenings or when you're out of the house, but it's better when you don't have to go anywhere, which is usually the weekends. You've said physically it's chest pains and palpitations, and you've started noticing you get hot and dizzy more recently. You've stopped being alone when possible. You carry your phone on you quite a lot in case of an emergency and started wearing layers to keep cool. You've not been able to sit in a coffee shop, which is something you used to enjoy. You've said that you have thoughts that you're going to have a heart attack and die, and more recently, you've felt that you were going to faint. Is that a good summary of everything you've said so far?
Yes, that's a good summary, I suppose. Thanks.
Great, let's move on. The next section has some difficult questions, so take your time and answer them honestly.
Okay, I'll answer honestly.
Good. Sometimes when people feel anxious or low, they have thoughts of ending their own life. Is this something you've experienced? It's not because you've said something that's worrying or concerning. We just like to make sure we give everyone the best help that we can.
I do have these thoughts about being out of it all around 2 to 3 times a week. These thoughts just pop in and out of my head quite quickly, and they are usually worse at night time when I'm alone thinking about my problem, and I worry that I won't learn to cope with it.
On a scale from 0 to 10, with 10 being very likely and 0 being very unlikely, how strong is the urge to act on these thoughts?
I'd say I've no intent to act on these thoughts, so around 1 out of 10.
On a scale from 0 to 10, with 10 being the worst it can be and 0 being the best it can be, how intense are these thoughts?
I'd say the intensity of these thoughts is around 4 out of 10.
On a scale from 0 to 10, with 10 being very impulsive and 0 being not impulsive at all, how impulsive are you when you have these thoughts?
I'd say 0 out of 10 most of the time, but if I'm panicking, I can find that I can act without thinking, so maybe 4 out of 10 in that case.
On a scale from 0 to 10, with 0 being no hope and 10 being the most hopeful, how hopeless do you feel due to your problem?
I'd probably say around 5 out of 10 for this one.
Do you have any plans to end your life?
No. I don't have any plans to end my life and wouldn't actually do anything to hurt myself. I just want to sort out my problems. Doing this to myself would just upset my family too much.
If you ever had thoughts about ending your own life, what would stop you?
If I ever had thoughts about doing it, my son Henry would be enough of a reason not to. But overall, I want to get better. I want to work and have a good life.
If you ever have these thoughts in the future, I can provide you phone numbers to call for support.
I'd most likely just talk to my GP because they're really helpful, but I'll take the contact numbers just in case.
Great, we're nearly done with this section. I just have a few more questions for you. On a scale from 0 to 10, with 0 being very unlikely and 10 being very likely, how likely would it be that you would end your own life?
I'd say 2 out of 10, because I hate feeling like this but don't know what to do. But I've not had any previous suicide attempts or thoughts.
Have you ever self-harmed?
No, I've never self-harmed.
Do you pose a threat to others, or are you at risk of harm from others?
No, I'm not a risk to others, and I'm not in any danger from other people.
Okay. Have you neglected yourself in any way since your problem started?
I'm a bit embarrassed to say this, but my diet is awful, which my GP said will not help my health.
Have you neglected others in any way since your problem started?
No. I always make sure that Henry is okay, and some of my worries are about not letting him be with anyone but me.
Okay, brilliant. So just to summarize, you've said that you've had thoughts of being out of it all, but that means to escape from the problems rather than ending your own life. You've said it happens a couple of times a week, and you rated the intent to act on these thoughts at 1 out of 10, which is very little intent to act. You've said you've made no plans or actions to act on these thoughts, but when you get them, you've said they are a little bit distressing, and you rated that at 4 out of 10. You've said you're not impulsive most of the time, but if panicking, you've found you can sometimes act impulsively. And currently at the moment you're feeling a little hopeless, rating this at 5 out of 10. You have strong protective factors in your son and family, and want to get better for yourself. You've said there's no self-harm or risk to or from others, and you're looking after your son Henry okay. You have struggled with some self-care, but you're aware of this and are trying to manage. Lastly, you have agreed to use the contact numbers if you need them. From what you've told me, I would consider you to be a low risk at the moment, but we will check in on this each week, just in case it changes. Would you say that everything I've summarized is correct?
Yeah, that all sounds right.
You might have mentioned some of these things, but I just wanted to make sure that I have a clear picture with how your problems are impacting different areas of your life. So could you tell me how it's impacting your work life at the moment?
I'm struggling with work. I've been off on sick leave a few times in the past few months. I felt like I couldn't go in because of my chest pains.
How is your problem impacting your home life?
I'm doing okay. I'm at home a lot more often nowadays, so I'm finding more time to do the cleaning. I do struggle in the morning though due to being tired and find it difficult to get going. I am struggling with the shopping though, because I can't go unless someone comes with me.
How is your problem impacting your finances?
I'm doing okay, but if I take any more time off work, then I might start to struggle, as I can't go off on sick leave again. I think I'm going to have to start working part-time now.
How is your problem impacting your social life or hobbies?
I used to read regularly, but it seems like too much hassle now because I can't concentrate. I used to meet my mates in the pub, but we don't meet anymore because I don't like leaving the house. I do have one good friend who calls round to see me every few weeks, which makes me feel a bit better. Other than that, I used to try and make sure that the weekends were fun for Henry, and I regularly planned trips out with him. But I've stopped doing this now.
How is your problem impacting your family life?
I love my family very much, and my mother supports me a lot, but I worry that she is going to get fed up of being with me all the time. I could also spend more time with my partner. My problems are making our marriage difficult at times.
I now want us to look at the questionnaires that the GP asked you to complete for today. Did they explain what the questionnaires were for?
No, not really. They just asked me to complete them.
So there's a number of questionnaires that you've been asked to complete. The main ones for today is the GAD-7, which looks at anxiety and has 7 questions. And the second questionnaire is the phobia scales, which is 3 scales, which looks at how much you avoid situations at the moment. These questionnaires will help us monitor how you've been feeling over the last few weeks and support some of the things you've said today. Now let's take a look at what your scores are. On the GAD-7 questionnaire, you scored 15. That falls into the severe anxiety range. On the first phobia scale, you scored 4, which means you definitely avoid social situations due to a fear or being embarrassed. This score fits in with the symptoms that you've told me you've been experiencing. On the second phobia scale, you scored 0, which means you would not avoid certain situations because of a fear of having a panic attack or other distressing symptoms. I don't think this score aligns with the symptoms that you've told me you've been experiencing. On the third phobia scale, you scored 0, which means you would not avoid situations because of a fear of particular activities or objects. This aligns with the symptoms you've told me you've been experiencing. Just before we move on to the final part of the session, I've just got a few more questions I'd like to ask. One of the important parts of therapy is setting goals, and we like to do this by setting short, medium, and long-term goals. Short-term goals are things we will hopefully be working on together, with our medium and long-term goals being things you can work on with the skills you've learnt from our meetings. So, can you tell me a short-term goal of yours?
A short-term goal for me would be to be able to take the dogs to the park for a walk again and go out alone with Henry.
That's great. What would be a medium-term goal?
A medium-term goal would be to be able to go to a coffee shop alone and do the weekly food shopping alone.
Perfect. And what would be a long-term goal?
A long-term goal would be to be back to work properly and not taking lots of time off.
Great. I'm now going to quickly ask you a few questions relating to your medical history. Have you had any episodes like this in the past? And if so, have you had any treatment?
I've no previous experiences like this or previous treatments for my problems.
Okay. Have you ever used illicit drugs or drank alcohol?
No, I do not take any drugs, and I've stopped drinking as it was making me feel worse.
Do you smoke?
No, I don't smoke.
Do you drink coffee or anything with caffeine in it?
I drink a lot of coffee, to be honest. I drink at least 6 mugs a day, but I stopped drinking it just before I go to bed.
Are you on any medication currently?
Not at the moment. I don't really want to take any medication at the minute, to be honest. The doctor did mention medication called propranolol, but they said that they would prefer that I try working on my problems first. So this is what I'm going to do for now.
Is there anything else you need to tell me relating to your medical history?
No, that's everything.
Okay, we're going to finish the session for today. Just before you go, I'd just like to remind you that I can provide you with contact numbers or resources that can support you further. I do think that exposure therapy will be the best course of action for you, and I can provide you some information leaflets on what that is. In the meantime, I think you should start working towards your short-term goals, and we'll catch up next week for an update on how you're getting on. Thank you for coming in today, and if there's anything I can do for you or if you have any more questions, please